I was employed for 30 years and I got laid off. I didn't have any insurance and I got sick. And a friend of mine told me about Good Shepherd. I didn't know what to do. I suffered for almost a month. Almost a month. I couldn't breathe. It was really bad. And found out it was bronchitis. Having insurance for almost 30 years and then all of a sudden you don't have anything, it's a really bad feeling. It's a really funny feeling. And like I said, this is the first time in 30 years I don't have insurance.
I lost my job. It's a fridge. I was having my first heart attack. It was over $40,000, and I couldn't pay that. Heart surgery has had a double bypass, and I didn't have no kind of money to pay that. And so we had to file bankruptcy on that. I didn't have no insurance after that.
Starting up my first patient this morning was a 21-year-old who is going to school and her parents lost their job. So she hasn't been able to get school insurance and she's just lagging. And she's having some medical issues today and needs to be seen.
Out of almost every single patient that I've seen, and I've worked in 4 or 5 different free clinics in the Oklahoma City area, almost all of them are employed.
I see 60-year-old women who they've been forced to retire from their job due to the economy, but they're not 65 yet, so they don't reach Medicare. And other insurances like Cobra or Independent Blue Links, Blue Cross, they charge $225 a month. And without any income, I mean, they just can't put their health care above the needs for their family and basic necessities.
There's people that they're not just lower class, they're middle class people, and they don't have, they don't have health insurance. Their job doesn't provide health insurance and they can't afford it for their family. So you'd be pretty amazed, I think most people would, that hadn't been in a free clinic, the kind of patient populations that we see.
Everyone in Central Oklahoma knows someone who's uninsured. It could be a family member, a friend, a coworker, a church member. We all are affected by the uninsured in our community. Who wouldn't want everyone who takes care of our children, our seniors, prepares our food, to have the best health care possible?
I'm an engineer with a master's degree in mechanical engineering. And I lost my job back 3 years ago. And if it wasn't for this clinic, I don't know what I would have done to deal with the problems that I've had. When I had my jobs, I had no problems. Even when I was in school, I had insurance back then. It was affordable and everything. But the last 3 years have been, everything seems to have changed, and it's just like everybody hungry for money, and if you don't have money, you don't get treatment. So thank God there's some people that they still welcome us.
We have currently 16 partner clinics in Oklahoma County, and as they have needs for their patients that they're unable to meet, they often turn to the Health Alliance to help meet those needs. And those needs may include pharmaceuticals, access to specialty referrals, surgeries, diagnostic imaging, diabetes wellness programs, just basic radiology services. Anything that primary care clinic can't do within its walls, we're there to help them meet those needs.
I have lupus, and shortly after I got lupus, I got hypertension. And, it's been like one problem after another, I didn't know anything about lupus. Had never even heard of it until they told me I had it. And so that was very scary, not knowing, having something and not knowing what you have. And I'm still a little confused on what I have, but it's even twice as scary knowing that I can't have a regular provider, and scary just the thought of what if I'm not able to, when my prescriptions run out, if how am I going to be able to keep getting my medications,
You hear a lot of doctors complaining about the bureaucracy in healthcare and how it's just become a lot of paperwork, and it's not about taking care of the patient. And well, in this setting, you can get back to just taking care of the patient. I don't have to worry about writing my notes a certain way in case Medicare audits me. I can write them the way that provides the information that I need. And I don't have to worry about what I'm doing for billing or making choices based on insurance, because nobody has insurance. And from that standpoint, it kind of brings some of the joy back to medicine, doing what I want to do, taking care of people.
And I really think it's just a responsibility that each of us has to help those in our community who are less fortunate.
Besides just the fact that it's just doing the right thing, which is probably the main reason I do it, there's certainly a level of joy that comes from it as well.
I don't often see a lot of the people that we help, but I'm able to understand that the work that I do makes a difference in a lot of lives, and that's very fulfilling.